The Trump administration has announced a controversial new Medicare pilot program that would require patients to get approval before undergoing medical procedures. A system critics are comparing to the so-called death panels that Republicans once used to attack Obamacare. This is breaking news from Washington. The Centers for Medicare and Medicaid Services will launch a pilot program in January across 6 states that fundamentally changes how traditional Medicare operates. Here's what's happening. Under this new system, Medicare patients would need prior authorization before receiving certain medical treatments, something traditional Medicare has historically avoided. The government plans to hire private companies that will use artificial intelligence to evaluate whether patients should be covered for procedures like skin grafts, nerve stimulator implants, and knee arthroscopy. The irony here is significant. During the Affordable Care Act debates, Republican lawmakers frequently warned about government bureaucrats making medical decisions, rhetoric that included references to death panels. Now, a Republican administration is implementing a system where AI and private contractors will help determine patient care under Medicare. Medicare serves approximately 67 million Americans, primarily seniors over 65 and younger people with disabilities. Unlike private insurance, traditional Medicare has operated with minimal prior authorization requirements, allowing patients to receive necessary treatments without extensive red tape. The Centers for Medicare and Medicaid Services, now led by Dr. Mehmet Oz, says the pilot program aims to crush fraud, waste, and abuse in the Medicare system. Officials emphasize that final decisions will be made by licensed clinicians, not machines, though AI will be used in the evaluation process. However, Democratic lawmakers are raising serious concerns. In a letter to Dr. Oz dated August 7, House Democrats argued that this new requirement will delay care and worsen health outcomes for Medicare beneficiaries. They point out that the Trump administration itself has previously acknowledged the harmful effects of prior authorization systems. The pilot program represents a significant shift in Medicare policy. Traditional Medicare has long been praised for its streamlined approach to coverage, particularly compared to private insurance plans that often require extensive prior authorization. This change could signal a broader move toward privatizing aspects of Medicare administration. Medical professionals and patient advocacy groups are watching this development closely, as prior authorization requirements in private insurance have been linked to treatment delays and, in some cases, worse patient outcomes. The use of artificial intelligence in these decisions adds another layer of complexity and concern. The program will initially roll out in 6 states, though officials have not yet specified which states will participate. The Centers for Medicare and Medicaid Services plans to evaluate the pilot's effectiveness before potentially expanding it nationwide. This story represents a significant policy shift that could affect millions of Medicare beneficiaries and highlights the ongoing debate over the role of government versus private sector involvement in healthcare administration. We'll continue following this developing story as more details emerge about the implementation and impact of this new Medicare prior authorization system.